Cloudflare, part of that hardening. Kim, I know there's a lot of work going on here, healthcare data being some of the most sensitive out there. Give us a state of the state as to where Cloudflare is positioning themselves here.
Yeah, I think what we're seeing is, healthcare, IT, and really the entire federal government, from what we see, is moving through two massive transitions at the same time. The first is really moving from single centralized cloud providers or data centers to more distributed multi-cloud environments. The second is, of course, the rapid adoption of artificial intelligence, which is like for everything from clinical decision support to patient scheduling. The problem is that security and data governance were kind of built for the old model, right? One firewall, one building, one controlled entry point. And that architecture doesn't really work when your clinicians are on mobile devices now, data lives in multiple clouds, and your patients are accessing care from home, from military bases overseas, or from rural clinics. So the trend we're seeing is that healthcare organizations aren't just moving data to the cloud, but they're actually moving secure access and intelligent processing to the edge. So closer to the patient, closer to where care is delivered. Because it doesn't really matter how powerful your clinical intelligence is if it lives in a data center that's across the country and a clinic can't get real-time answers. When we talk about distributing infrastructure everywhere, you are getting much closer to the population that the care is being delivered to, and just making real-time data available for patient triage, critical decisions actually usable. Obviously, speed means nothing if it isn't secure. So as data is moving out of centralized warehouses towards the clinician, you want to verify every identity, encrypt every connection, and inspect every interaction. Our network recently absorbed millions of attacks in a single day against a nationwide medical system without any disruption to their public-facing patient portals. So by stopping the attacks immediately at the edge, we free up a lot of infrastructure resources and remove kind of that noise that clogs systems and often creates strain on the good traffic as well. Like federal agencies really need that same resilience.
Delicate balance.